Hi there, I'm Kaylee. I'm going to be your nurse today.
Hi.
Do you mind confirming your name and your birth date for me?
Peyton Graham, 11/20/98.
Alright, I'm going to write my name up here on the board just in case you need me later. Do you mind telling me today's date?
It's the 3rd.
It is. Alright, awesome. So, what brings you in here today?
Just wanted a checkup, head to toe type of deal.
Oh, good. Alright, well, we'll make sure to do that today. Do you have any allergies that we need to be aware of before we get started?
Nope.
Alright, and there wasn't any isolation precautions on your chart when I came in, so I don't see any need for any PPE. So we're just going to do a head-to-toe assessment. And have you been experiencing pain at all anywhere?
Nope.
All right, that's good. So I don't see the need for a pain assessment. Do you have any previous history or illnesses that we should be aware of?
Nope.
Have you had any surgeries in the past?
Just my wisdom teeth.
Okay, and did that go okay? Did you have any issues with that?
No.
Are you currently taking any medication?
Nope.
All right, good. So you seem like you're in tip-top shape.
Oh, I sure am.
Okay, so today we're just going to do kind of the assessments of each section of your body. We're going to kind of do the head, your face and your mouth, check your breathing and do all that, but I'm just going to start out by taking your vital signs. Before I do that, I would say that my patient is conscious, alert, and oriented. She was able to tell me today's date, why she's here, how she's been feeling, so I don't see any need for a further mental health assessment. Alright, so I'm going to first start out by taking her pulse ox. Okay, and her pulse ox is 99, so that all looks good. All right, next I am going to take her heart rate. Alright, and her heart rate was 68, and while I was doing that, I also took a respiratory rate, which was 16, which are all within normal range. Next, I'm just going to take your heart rate, if that's okay with, your blood pressure. Okay. Just going to put this. Alright, and her blood pressure is 102/64, which is also a normal. Alright, so those all look really good. Did you take temperature? Okay. And then lastly, I'm going to take your temperature. And 98.2. So all your vital signs look really good. I don't see anything abnormal that I need to put in your chart. So now we're just going to start out by checking your skin, hair, and nails. Okay. So looking at the patient, I don't see any bruising anywhere or any swelling or anything abnormal. Have you been had any abnormal skin irritations or bruising or any lesions that we need to be aware of?
Nope.
The patient's nails look good. They're nice and thick color. When I pinch them, they have a capillary refill in less than 3 seconds. Her hygiene seems really good. Looking at her head, it's all nice and normally distributed. I don't see any bald spots, and it's thick enough, and everything looks normal with that. I don't see any bugs or lesions as well, and I don't see any cuts inside or on top of the head. Everything looks good. When I was palpating the patient, she had a really nice good skin temperature and texture. Everything felt warm. I didn't see anything abnormal. The moisture was nice and normal, and I didn't see any redness in the elbows or in the heels or anything, or especially not on her knees. You don't have any wounds present, and I don't see any edemas. The scalp all looked normal, and all the extremities were nice and even and symmetrical, and there was nothing abnormal when I was looking. Next, I'm just going to look at your eyes, ears, and your mouth. I'm going to check your pupils instead of you mind just looking straight ahead. When I shine the light on the patient, her eyes accommodate and reflect to the light, and then when she follows this in, her eyes are able to accommodate as well. Looking at the patient's ear, I don't see any lesions or swelling or any abnormal drainage. Everything looks normal there. Do you mind opening your mouth for me? Looking in her mouth, I don't see any redness or swelling or any wounds present. That looks to be a nice normal skin color. All the circulation looks good. I don't see any lesions on her tongue. Do you mind closing your mouth and smiling for me? She's got a nice full set of teeth. Her hygiene looks good, and I don't see any lesions or redness or swelling in her mouth or her gums. So all that looks really good. Taking a step back and looking at the patient's face, it's nice and symmetrical. I don't see any drooping at all. Do you have any trouble moving your face?
No.
Okay, everything looks good and nice and equal there. Her pupils looked equal. Everything looks good, and her face has got a nice even contour, and her nose all looks normal too as well. All right, next I'm going to take a look at the patient's chest, and I'm just going to have you sit on the edge of the bed for me. And I'm just going to check a few things. I'm just going to have you take a deep breath in, and then by release. Good. So she has nice symmetrical chest expansion when she takes a deep breath. And then I'm just going to listen to your chest sounds. So I'm going to start by looking in the back of the chest. Every time I move my stethoscope, take a deep breath. I'll just front of your chest, also take a deep breath. Alright, and after listening to the patient's lungs, I don't hear any crackling or anything. Everything seems normal. All the breath sounds are nice and even, and when I did do the test in the back, her expansion was symmetrical. Next, I'm just going to palpate for some of your pulses, but I just want to, does this cause you any pain?
No.
Nothing on your back?
No.
Okay, cool. So then I'm going to feel your pulse here. And then I would also do her pedal pulse if I had the pedal pulse listener. So all of her pulses were nice and strong. Everything sounded normal. And before we move on to the abdomen, I'm just going to take a listen to your heart sounds. Okay, and so she had nice, really clear heart sounds. The S1 and S2 were clear. I didn't hear any signs of stenosis or regurgitation. The lub dub was really good, and I didn't find anything unusual that would be needed for a follow-up assessment that would go deeper into cardiovascular. So next I'm just going to have you lay down on your back, and I'm going to check in your abdomen. All Alright, looking at the patient, her abdomen looks nice and symmetrical. I don't see any abnormalities or swelling or anything, no lesions, and her stomach's not distended. Have you been experiencing any stomach pain at all?
Nope.
Okay, so I'm just gonna listen to each of the quadrants. Normally you would listen to each quadrant for a minute, but I'm just gonna listen until I hear a vowel sound in each. Alright, so she had nice normal vowel sounds. I didn't notice anything that would suggest it being hyperactive or hypoactive. It seemed normal. Next I'm just going to kind of palpate each of the regions. Let me know if this causes you any pain at all. That didn't hurt you at all?
Nope.
And I didn't feel any lumps or anything abnormal that I would need to go into further assessment about. Nothing unusual. How often do you go to the bathroom?
I would say, well, number 1, a few times a day. Number 2, every other day.
Okay, and those haven't changed recently or anything?
Nope.
Everything's been normal?
Mhm.
Alright, that looks good. And your bowel hasn't been anything abnormal, if you've looked?
Nope.
Okay, next I'm just going to take a look at your extremities. If you don't mind sitting on the edge of the bed for me one more time, I'm just going to kind of be able to inspect them. Alright, looking at her arms, they're nice and symmetrical. I don't feel any abnormal swelling on one. Everything looks good. Her hands look good. Her legs are nice and symmetrical as well. They're nice and even in length. Everything looks normal with that. Do you mind gripping my hand for me? On the other hand? So the patient's hand strength is really good. So I would give her a 15 on the Glasgow Coma scale because her eyes has been reactive. She's been able to talk with me and she's conscious, learner oriented ×3 to the place. The patient's full weight bearing. She doesn't have any assistive devices at home, correct?
Correct.
All right, and she's had no problem sitting up on her own and maneuvering. I'm just gonna check some of your muscle movements. So if you lift your feet up against me, down against me, your legs up, down, your shoulders up, back down, and go forward, and then backwards, and your arms backwards, and then forwards. Hands down and then up. Okay, so all of her muscles seem to be intact. None of that caused you any pain at all, right?
Correct.
Okay, so that looks good. I'm just going to have you stand up, or we're going to check your gait. Do you mind taking 5 steps towards me? And then on your toes on the way back. And then on your heels back towards me. Okay, good. Everything looks normal with that. You don't seem to be a fall risk at all. And I don't see any need for further assessment with any of those things. So I'm just going to have you sit back down. I'll make sure to document everything in your chart. I did not find anything abnormal, so I don't see any need for any interventions. I would make sure both the bedside rails are up. The bed is in the lowest position. This is the call light, and the red button's how you get a hold of me. Is there anything else I can do for you today?
Nope, I'm good.
All right, good. Thank you.